Hello, thank you for watching. This is Dr. Emil. Are you a mother or a father and you have this little baby and this baby has been diagnosed with a bacterial infection and now your doctor prescribes the course of antibiotics? Then please look at this video. Also, if you already did this course of antibiotics and now a couple of days later you start to see all kind of other serious health issues which really concern you. For example, you start to see this redness, this swelling, these rashes on his or her skin. You start to see ulcers in the mouth, some oral thrush. The baby is suffering from stomach issues, does not want to eat anymore, and if you have a little girl, all of a sudden you start to see some serious issues in her private parts, all this irritation, this swelling, this redness, and this white yellowish substance called vaginal thrush. Then please take this video seriously. Please look at it, because in this video I'm going to explain you where it all comes from. I'm going to explain you also what you need to do, and I'm going to explain you some alternatives to the standard antibiotics medication. So please keep watching. Antibiotics is a super important medication. Since its invention in the year 1928, it has saved the lives of millions and millions and millions of people worldwide. And if you are suffering from a serious bacterial infection, and I stress the word serious, then often antibiotics is the only thing that is really going to help and save you. However, we must be informed, we must be aware of the serious negative side effects of antibiotics, especially when you start administering these antibiotics to your little baby, because babies are going to be much more sensitive to these negative side effects. And I have to stress that often these side effects is not just short term for a couple of days or weeks. If you overdose with antibiotics on a little baby, it can really affect their whole life. I know persons, I have friends of mine in their 50s or their 60s who are suffering from extreme poor immune system, and if you trace it back 50, 60 years back in time, it all comes down to the over administering of antibiotics for when they were a little child. Also, on a personal level, I have a cousin 8 years of age who is unfortunately suffering from a lot of asthma. If you trace that back, it also started already at the age of 3 months, when the mother was forced by the doctor to administer a lot of antibiotics to the little boy. So be careful with antibiotics, and if you decide to give antibiotics to your little baby, often we don't have a choice, but you have to follow certain rules. And rule number 1 is that you can only give antibiotics when you are 100% sure that you're dealing with a serious bacterial infection, and 100% sure you can only get after doing a proper blood test by your doctor. So just a guess by your doctor, looking at some symptoms and thinking it is a bacterial infection, it is not good enough. Also, don't keep the bottle of antibiotics in your home and thinking that it will help with all kind of issues. If your baby has a cold or something, or a viral infection, don't give the antibiotics. It is not going to help, it is going to harm your little baby. Rule number 2, if you start with a course of antibiotics, you have to complete the course. Course often is like 5 days, 7 days, 10 days. It is not some medication that you just try for 1 or 2 days. You see some improvement, so you think, you know what, I can stop with it. Or maybe your baby is going to seriously resist and going to fight and scream and cry when you give the antibiotics. And after 2 days, you as a mother or a father, you cannot deal with that pain of your little baby anymore, and you decide, you know what, I stop, because now you are creating the risk that your little boy or little girl is going to become resistant to these antibiotics, and now you create a real problem in the future, that now the child will really need these antibiotics, and now it is not working anymore. Because antibiotics, I will explain it a little bit more further in the video, it works by killing all your bacteria. Unfortunately, not just all the bad bacteria, but it also kills and destroys all these good bacteria that your little baby was just developing based on the breast milk and the simple food that it was getting. So be careful with giving antibiotics. And the third advice I give you is that you can only give antibiotics if you're dealing with a serious bacterial infection. If it's just a starting bacterial infection, I advise you to please try something else. And when I mention something else, I talk about natural antibiotics. Natural antibiotics, I myself already for many years, I often use the combination of oregano oil and colloidal silver. This combination, you can check it on the internet. You can find real professional clinical studies from top hospitals, double-blind, placebo-controlled, proving that this combination, oregano oil and colloidal silver, is the strongest natural antioxidant in the world. But there's also many other plants and herbs, I explain that also on this channel, which also have antioxidant properties, such as here in Africa I also often drink some tea with an herb called dingi. Super effective, you feel immediately the improvement. At the end of this video I want to explain about one serious side effect of using antibiotics on a little baby girl, and that is that you can start to see a lot of irritation around her private parts, and it is really very painful for a mother or a father to see your little baby girl suffering from all this irritation around her vagina. So what you will typically see is a lot of redness, rashes, swelling around the vagina. You see all this vaginal discharge, this whitish yellowish substance, and it is all due as a side effect of the antibiotics medication. What it is the production of yeast, an overproduction of yeast. It is also called candidiasis. It's not just that these little children are suffering from it, many adult women are suffering from it also after use of antibiotics. So it's this overgrowth of yeast. Your body consists of a balance of bacteria and yeast, especially in your vagina. That balance has to be optimal. So you have a lot of bacteria called lactobacillus bacteria. They normally control that yeast, but if the antibiotics, it kills all those bacteria, now the yeast starts to grow and grow and grow, and that can last for weeks and weeks and weeks. It is really painful to see. What you can do is you can use some antifungal medication. It's reducing the yeast. And also what I advise is after antibiotics to start with something called probiotics. And probiotics will help, together with breast milk and other things, it will help your baby to regrow the good bacteria. But often it takes a lot of weeks, sometimes even months, before your baby gets back to where it came from. Okay, I hope the information in this video was informative for you, that it helped you. If you have any questions, let me know. If you like this video, there's more videos like this on this channel. Please click on like, but more important, please click on subscribe, and I will be thankful. Thank you.